Good evening once again. I'm Leah Lando. Thank you for joining us tonight. Healthcare looks different for millions of New Yorkers because of a new benefits program from the state. While New York leaders are promoting the benefits from this new system, some Western New Yorkers say they're already running into problems less than a week after it launched. Anyone previously covered by Medicaid in New York is now under the NYRx program. It's a change impacting roughly 8 million people across the state. Now, according to the health department, patients will be able to access more medication with fewer restrictions. And pharmacies will no longer be reimbursed by third-party companies, but instead directly by the state. But some clients already reporting problems with this. 7 News senior reporter Eileen Buckley spoke with a young woman who says she's lost access to her insulin drug.
It's very upsetting. I don't know where to go from here. I am at a loss.
Devin Schwader of Medina is desperately waiting for her insulin drug to treat her type 1 diabetes. She's on Medicaid, working part-time as she completes her nursing program this May. But with the new NYRx program, Schwader says she's been blocked from getting her medications for her insulin pump.
But now they're saying that it's a 30-day wait for the prior authorization. In 30 days, you can't wait 30 days.
NYRx now allows the state to pay pharmacy costs directly, eliminating managed care organizations. The program is designed to provide improved prescription drug access for all Medicaid clients.
So when I called Medicaid, I was trying to get numbers so that they can process the prior authorization. They were saying that I don't need new numbers. My endocrinologist was saying that I need new numbers, that the numbers that I had will deny my supplies, and then they won't be able to resubmit it until they go through this whole entire list of everybody else.
Pharmacist Don Arthur tells me that pharmacists are totally in support of this new program.
The launch has been great. New York State, they've been working on this program for 2 years.
Arthur owns the Brighton Eggert and Blackrock pharmacies. I asked him why Schwader might be having trouble.
If there are isolated problems, and there will be, when you're talking about transitioning, and they were transitioning not just from one plan, they were transitioning from a Blue Cross plan, an independent health plan, a Univera plan. Depending on who her pharmacy provider is, there are some steps and hoops that we have to jump through initially.
I read an article that was by the governor saying that it was going to be a seamless process. This is not a seamless process.
Now, I reached out to the state health department, which issued a written statement saying in part, instead of working through varying rules and limitations for coverage under managed care organizations, pharmacists and physicians will be able to prescribe medication based on a uniform list that is less restrictive and governed by an independent public board of experts. Eileen Buckley, 7 News.
All right, Eileen, thank you for that. Also tonight, a family search for answers 2 months after their brother was shot and killed in Cheektowaga. 24-year-old D'Angelo Williams was found with several gunshot wounds outside the 33 Speakeasy Grill in late February. As Jordan Johnson tells us, the family is calling for anyone with information to come forward.
A brother, son, and uncle.
He was 24, pretty much at the prime of his life.
D'Angelo Williams was shot in the parking lot of the 33 Speakeasy in the early morning of February 22nd. Family and police say he was trying to break up a fight when he was killed.
It's hard, doing things without him now, knowing that there'll never be, another celebration to which our brother can attend.
Cheektowaga police have interviewed several witnesses and bar goers, but still